And I'll kick us off and get started. So again, my name is George Huntley. I am the Chief Executive Officer of the Diabetes Patient Advocacy Coalition. It is my pleasure to have you with us today to talk about the state of diabetes and really legislation, and we're in the state of Indiana. I myself am a Hoosier. I live up in the Carmel area and have been in Indiana for a few decades now. I am also a patient living with type 1 diabetes. I keep my insulin pump here in case I need to adjust it or show it off on camera. But I have been a patient since 1983. And I've been an advocate since the late 1980s. So I've been doing this a very long time. And it is, again, my pleasure to be with you. And let's talk about what we're going to what we're going to do and how we're going to spend our next hour. I'm seeing it in the notes here. 371,000 disabled Hoosiers have diabetes. Yeah, that's a lot. There's a lot of Hoosiers that have diabetes. In fact, there's millions, hundreds of thousands of people with diabetes. So we have first welcome and introduction. I'm glad you're here. We're going to have a legislative overview. And we're going to talk to, hopefully Senator Bro is in the process of joining us. We're then going to go through how sausage is made and tell everybody how that process works and why it takes so long, why it's so hard. We'll also cover Diabetes Advocacy 101. We're going to go through some hot topics. We're going to talk about how to be an effective advocate and how to be a DPAC champion. And then we're going to wrap up and have next steps before the evening Winter Olympics come on. So hopefully we'll get there, and welcome to everybody who's here. So housekeeping notes, we ask you to please use the Q&A feature on the bottom panel so that if you have questions or if you're having technical difficulties. So please do that, and we'll take a shot at getting those answers to the panelists, and also helping you out if you have technical difficulties. And this meeting is being recorded. As I just mentioned, we're on Facebook Live as well, and hope you enjoy the conversation. So who is DPAC, the Diabetes Patient Advocacy Coalition? Our mission is really twofold. The first is to ensure quality and access of care for medications, devices, what a patient with diabetes needs. How do you live with this disease successfully and fruitfully? That's what we're all about, making sure that you've got access to what you need through all of the areas that you should get it from. The other part of our mission is to educate and inspire and empower advocates like yourselves, like the folks on this call, which we're very grateful to have this opportunity to do, as well as lawmakers, and having a dialogue with them so that we can make meaningful change, take meaningful action to help people with diabetes. And also, please follow us on social media. We'll talk about that a little bit as we go, but we can't do this without you. You guys are really, really important. So that's what today's about. DPAC is also affiliated with the Diabetes Leadership Council, and I'm in full disclosure, I'm the CEO of both organizations. The Diabetes Leadership Council is a 501c3. We are a policy shop. Everybody on the DLC board is a past leader of a national diabetes organization, national diabetes nonprofit. Many of us are past national chairs of the American Diabetes Association, and we have many folks from other organizations as well. We have a policy shop that we go through and do the research on what the issues are. DPAC is the patient army. You all are the army, and we empower the patients to have their voices heard through the policy work that we do together. So let's get into the Indiana legislative overview and talk about what we're going to talk about in Indiana. And I'm hoping that okay, here we go. So we have a legislation scorecard that we go state by state by state with. And the state of Indiana does not have a very good score. And as you can see here, we've got a diabetes action plan, but we don't have a diabetes caucus. There are states that have a caucus. We do not have copay caps for insulin. We do not have a copay accumulator ban, and we'll talk a little bit further about some of these things as we get into the deeper into the topics themselves. We do not have first dollar coverage for diabetes diabetes care and medicine and supplies, which would make them pre-deductible. We have a rebate pass-through bill actually active at this moment, and we'll talk about that today, Senate Bill 88. And that, so you see that briefcase, that's actually active, and we need your help on it. We need your help to get that through. It passed the Senate, but it is now stuck in the House Insurance Committee. We do have care for Medicaid coverage for CGMs, continuous glucose monitors, which is a good thing. But we don't have an emergency access to insulin law, which would give 30-day access emergency supplies for insulin. Many states have that. Many states have insulin copay caps. We've got a lot of work to do in Indiana, so we're very, very pleased that you all are with us to join in and take this work on, because it takes all of our voices to make it happen. And I'm going to invite it, and I'm hoping that we have the panelist on, but I'm going to now invite Ed Hawthorne, my good friend, to join us here he's the panel moderator for the Indiana State Government panel. Ed is the COO and Managing Director for CE3 Solutions. He's based out in California. He is also the Vice Chair of the Diabetes Leadership Council, as well as a past National Chair of the Board of the American Diabetes Association. And we are very happy and pleased and privileged to have Ed with us this afternoon. Ed, welcome, and thanks for being with us. Was Senator Breaux able to join us?
Hi, George. Senator Breaux has not been able to join us at this time, unfortunately.
Okay, that's unfortunate. So we were to have, unfortunately, Senator Breaux, who is on the Senate Health and Provider Services Committee, and I've actually testified to that committee on this bill, was scheduled to be with us, and unfortunately she may be running late, or may have had a technical difficulty. We're not sure what's going on here. But Ed, let's just talk you and I for a moment, because we have done this. The audience doesn't really know this, but we have done a dozen of these across the country, and we're going state by state by state to empower advocates, educate advocates, and talk about what's going on specifically in those states. But we've had panels of legislators that you've had the opportunity to speak with. Mm-hmm. Could you just share a little bit? What are the themes that you're hearing from the legislators as far as how they like to interact with advocates and what's on their minds?
Well, let me start with one of the common themes is that diabetes is, it's not a partisan issue. And every one of these sessions that we've had, diabetes is bipartisan. And legislators recognize that their constituents are impacted significantly by this disease. And what I found really interesting was that a number of the sessions we've had panels that were represented on both sides of the aisle, Republicans and Democrats. And as we went through the conversations about diabetes and the types of how people with diabetes are impacted and the kinds of changes that we need to move forward, it's been really interesting that I could not tell who was the Republican and who was the Democrat. And to listen to them talk about ways that they partner across the aisle, look at the ways that they partner with bringing in their other members into a much broader conversation around diabetes has been really interesting. I mean, and I think that if we could continue to get that type of work going on across both aisles, I mean, we could actually make a huge dent in this in a positive way for all people living with diabetes.
Yeah, and that is, it shouldn't be a partisan issue, and it is, and we'll talk because we've got a partisan issue. We have an issue going on right now in Indiana that we'll talk about. When you've had the panelists and they're talking to you about, how do how do they like to be engaged? What have you heard from on that topic?
Well, let me talk about a little bit. And I'll start with another topic first. The other interesting point that I found was that legislators who have a direct and visible connection with diabetes seem to push much harder because they've experienced it firsthand, either directly or through themselves or with their family. The other thing that we asked them about is, how can we help them? And before we do that, I see that Senator Breaux has joined, George. So
that's great.
I turn that back over to you.
Well, actually, I'm going to turn it over to you to moderate to introduce Senator Breaux and welcome Senator Breaux to the Advocacy Forum for Indiana, and we appreciate you being here. I'm going to turn this over to Ed Hawthorne, who is going to be the moderator and have a quick conversation with you. Thank you so much for being with us.
Let me take my mask off.
All right, well, thanks, George. And for today's session, we are so grateful to have with us today Senator Jean Breaux, a legislative champion for people with diabetes and other chronic conditions. Now,
Absolutely.
Senator Breaux was elected to the Indiana State Senate in 2006, where she represents Indianapolis residents in the 34th District. In the State House, she serves as the minority ranking member for the Senate Health and Provider Services Committee, as well as the Public Policy and Agriculture Committee, and previously served as Assistant Democratic Leader until 2020. Her experience has led her to receive numerous committee appointments for the National Conference of State Legislators, including for Health and Human Services. Senator Breaux graduated from Indiana Wesleyan University with a degree in business administration. So welcome, thank you for joining us. It's a pleasure to have you.
It's an honor to be here, and I apologize for being a little late, but we have a committee meeting that I actually walked out on to come join this conversation, because I do believe diabetes and chronic health conditions, particularly in communities of color, is a very worthwhile conversation. And it's something I've been working very, very hard on the health committee to get my colleagues who are on the other side of the aisle to really understand that. And finally, I feel so gratified that finally we have come to a point where they recognize, as I have been trying to get them to recognize, that we as a health committee and health and provider services, we need to be looking at public health. I mean, on the House, they call it public health. We call it health and provider services, but at the end of the day, it's public health. And the health of our public here in the state of Indiana is not well. And in large part, it's from these chronic diseases that, if managed and intervened and provided a significant education, we can try to reduce the onset of some of these conditions that become long-term and actually fatal and can be fatal. So this is an important conversation. Thank you for helping me get my colleagues on the other side to join me in recognizing that we have a commission that's been started by the governor, whose responsibility it is to really look at public health, not clinical health, but public health. The governor has specifically identified that we need to focus on public health. And this commission is looking at all of the ways in which there are so many holes in the way healthcare is administered and accessed in the state. They are going to come back and they have a specific timeline, and I can't remember what exactly it is, but they're going to come back with a very detailed presentation to the governor, and they're already starting to work on the legislature, because ultimately what they seem to understand is that we, on a per capita basis, spend very little dollars on healthcare here in Indiana. And so the first thing we need to do is appropriate properly. The first thing we need to do is ensure that we start to invest in healthcare, because investing in healthcare is investing in Indiana and the healthiness and the viability and survivability of Hoosier. So that's the first thing. And yeah, so anyway, I'll stop there. It's
All right,
just
well, don't stop because you got you on the roll. But I'm going to ask you a question. In that, so everyone has a connection directly or indirectly to diabetes. So can you tell us yours and why you work on this particular issue?
well, for me, it's the where diabetes, if unchecked, can go, and how diabetes does not have to be. Now, I know there's some, the type 1 is different, but many Americans are really suffering from type 2 diabetes, which, with proper education on diet and exercise and basic public health, taking care of yourself, we can intervene on the onset of diabetes and really try to change that trajectory. But if we don't, and if we're unsuccessful in intervening, then what can happen? Diabetes can lead to all sorts of other kinds of ailments. They can result in heart disease. It can result in obesity. It can result in kidney failure. It can result in diabetes. It can result in, excuse me, not diabetes. It can result in dialysis, and can result in death. And and it's extremely expensive to take care of. But on the back end, which is where the state of Indiana has always spent its money, trying to pay for those who are on particularly Medicaid, who are suffering from diabetes. A large portion of our budget goes to that. But if we flip that picture and start to put some of those dollars on the front end, we can teach people how to eat properly. We can teach people about the importance of just walking a little bit, getting up and doing a little bit of exercise. You don't have to be Arnold Schwarzenegger or people like that, but just do a little bit of exercise. We can teach you how not to engage in poor health choices like smoking or ingesting other kinds of vapor cigarettes, or we could try to educate. We can't change behavior, but we can reiterate over and over and over again some very basic, simple facts, and then show you the long-term consequences of denying these basic facts, and then hopefully people can choose which way they want to go.
Well, in addition to the education, I mean, we still have to solve the broader issue of, food deserts, health deserts. I mean, you could do education, but if people don't have access,
True, absolutely.
they got the education, but they still can't make a move. So,
And you're absolutely right, because diet is extremely important. And so there has to be a place for folks to get fresh fruits and vegetables at a reasonable price, leaner products at a reasonable price, leaner meats, low fat, other items. And so, yes, we've been working on food deserts. We're still working on food deserts. Hopefully, this group that the governor has appointed will look at the access issue, and we will try to address that. But we are down here as a minority legislator, because so many of these issues are prevalent so heavily in in communities of color. We are down here fighting for those kinds of things. It's just we have to educate the folks in our chambers first, and we're working to do that, but that takes a little time.
It does. So now you have voted on Senate Bill 88 this session, which requires rebates be passed through to patients at point of sale. Could you share more about the bill, its impact for people with chronic conditions, and what brought you to support it?
Well, ultimately, the bill really only applies to a small section of the population. It's those folks that have private insurance that they buy off of the healthcare market. It won't affect self-insured plans, which are large corporations generally. So there was a little concern about that we need to be broadening that, but that we are able to at least get this done is for me a starting point. But what it says is that if you are in a plan and you have a brand name drug, in particular, as it relates to diabetes, if you have to purchase insulin, you will now be able to get the savings that the manufacturer of insulin provides to your healthcare plan or to your pharmacy. Instead of going to those folks, it will really come to you, so that at the point of sale, you're really able to receive your prescription at a more affordable rate. I had that experience recently. I went to buy a prescription for a health condition that I have, and it was like $1,000 out of pocket, because I'm at the start of my uh, coverage, and I have to pay for a certain amount until I reach my deductible. And then she came back and said, well, we have a rebate that the manufacturer has on this product, and we will pass that along to you. And so it dropped it down to about 400. It dropped it down to $400 from 1,000. Still a lot of money. Still an awful lot of money. But those rebates, when at the point of sale, will help folks who have to purchase insulin and keep them from having to either make the dose last longer by taking half at a time, or preventing them from getting it all together. So anyone who is on this call who is a diabetic, go to your pharmacy and ask about this rebate, and make sure that you are eligible to receive it.
Great, thank you. Now, I appreciate all the work that you're doing on that. And also, as a member of the Senate Health and Provider Services Committee, your work with colleagues from different parties and different areas of the state. Could you speak broadly to some of the health priorities for the committee, as well as your caucus, and what they might mean for the chronic disease community?
Well, here comes my lunch. Yes, you're right. The Health and Provider Services Committee is made up of majority Republicans and Democrats. And so, again, we have to keep the focus on public health, and not some of the niche issues that we find ourselves voting on because it's a priority for the Republicans. The Republicans are really concerned about transparency and billing, about the ability to have balanced billing, so that if you get a service and your insurance company only pays a portion of it, then the remaining balance is yours, and there are people that will go about collecting that money from you. So there's a lot of emphasis on that. But for us, we're concerned about infant mortality. We're concerned, the Democrats are really focused on trying to really address some of the key indices that show that we're very low or very high, depending on how you look at it. But we have too much infant mortality, and that's where babies don't live throughout the first year. We have too many. We just recently, thanks to federal government, are now able to extend pregnancy services to mothers on Medicaid, postpartum services from 6 months now to 1 year. That will hopefully help maternal mortality rates to decrease, and it will also help infant mortality rates to decrease, because hopefully we stopped providing any services or any kind of assistance to new mothers after 6 months. That's when you're just getting started learning what it means to be a mother, and understanding the baby and understanding all the needs that the baby has. So now we've extended that to 12 months. So that is a move in the right direction. We are concerned about food deserts. We are concerned about mental health and mental health parity. And are we focused enough on providing access to mental health? Because this COVID has revealed that a lot of us are kind of, unbalanced and, being cooped up and, arguing over, should I wear a mask? And if I go out without a mask, do I have to run and get a COVID test? All of that is a lot of stress. And so mental health dollars need to, and services need to be more balanced, applied in a more balanced way across the state. We're working on that. So, we're trying to keep the focus on the health of the individual. And sometimes we're able to sway our colleagues, but they just don't, minority members of the General Assembly, many of them, most of them, represent very urban communities, which is a very different population than what Republicans represent, with many of them, most of them representing rural communities. And so it's hard sometimes for them to understand some of the current concerns that we have as minority legislators. But again, we're keeping in the fight, and we're trying to educate every day as we go along.
Well, the fight and the dialogue. I mean, the idea is that you never cross the bridge if you never talk about it. So, that dialogue that you keep going educates both sides to bring about a better understanding of that. The other question, so, COVID, I think, COVID has taken so many lives and people are dealing with COVID fatigue and all, but as well as COVID has had its impact on diabetes. And it's also had a disproportionate impact on certain segments of our population, generally referred to as health inequity. And again, those things fall back to falls back to three things: availability, access, and affordability. So how are the leaders in Indiana working across this for communities of color?
Well, I think there has been COVID has revealed it hasn't revealed it to many people who already knew that there was inequity, but it has exacerbated it. It has made it the gap so large that you can't avoid the recognition that it exists. And so I think there has become much greater understanding of that issue by all members of the Indiana General Assembly. And so we have been able to pull some folks in to the realization that there needs to be a focused effort on minority populations. And we were able to last year in 1007, I think that was the bill number, House Bill 1007, which for me, I was crying at the microphone because they accepted an amendment that I had that required them to make sure that some of this funding went to communities of color to address chronic health disease and screening in ways that communities of color can access. And so we're still in the process of developing the guidelines for that. But there was a bill last session, House Bill 1007, that appropriated $50 million to understanding the landscape in Indiana and trying to figure out how that $50 million can be appropriated to address some of these, huge gaps. Now, it doesn't focus specifically on minorities, but as I said, I made an amendment that was recognized that it has to ensure that some of those dollars go to minorities, that it has to have a intentional focus on funding minority organizations or minority programs that address some of the gaps and the inequalities. So I think that we are starting to get some understanding. There's still some pockets of resistance that for whatever, there are many reasons why they do not want to see a focused effort on communities of color. But, I've been pleased by how many newbies we've brought along. And I need to get back and look at what's happening with that $50 million. But again, an appropriation, an amendment was applied that did say we have to address minority communities. And the focus is chronic health and access, and how we can put more services in places where there will be greater access.
Oh, that is awesome. Well, Senator Breaux, I want to thank you so much for all of the work that you do in your tireless efforts to make a difference for all people living with diabetes and other chronic diseases. And thank you for your time today. And before I turn it back over to George, the last question that we always have is about ways that our smart advocates can help you and work with you to engage their representatives. And we often hear that a couple of people writing in can get everyone's attention. So if you can leave us with that thought, and then we'll turn it over to George.
Well, first, let me compliment you on your skills as a moderator and inquisitor is what I'll call you. These questions were very presented very well. So thank you for that. But yes, we have an advocacy program. And when I say we, I say the Indiana Black Legislative Caucus, of which I'm a member, where we, if you go to our website, we have a list of bills that we believe are good bills for our communities, and a list of bills that we think are not quite as good and that we need some help in stopping. And trust me, I can't, the only one that I can think of right now off the top of my head was a few years ago, right after Donald Trump was elected, there were, lots of protests. And so there was a piece of legislation that was born out of that said that protests couldn't be allowed anywhere in Indiana, and the police could break them up using any means necessary. Well, that was, really broad and couldn't result in fatalities just by the mere fact that any means necessary is a very broad latitude that it provided, and the using social media, and I don't know how they did it, but the young people came down here and packed this courthouse. I mean, this state house, and the committee room in which the bill was being heard was overflowing with people. I think you can see that now. I'm not on the education committee, but the anti-CRT language that's moving through the legislature right now is another example of people who've come out from all over the place, and they have packed these hallways and packed these committee rooms and have really made it clear to those folks who are peddling this legislation that they do not agree with it, they do not want it, and it made a difference with that any means necessary. That bill died. Now I don't know if this 1134 it's got a little bit more traction, but certainly people are looking at who's coming out and the number of people who are coming out, and that kind of advocacy and support makes a difference. So if you feel comfortable coming in person, we encourage you to do that. You can also send us an email or a written letter, or you can call us. I accept all of those. But I encourage you to take a look at the health committee, look at the bills that we're moving forward this session, and give me a call personally if you've got some suggestions or ideas to change the bill. It's getting a little late in the process, but we can always try to stick it in somewhere before the end of the session. So yeah, I need the help of folks to give me some. I don't have diabetes, so I don't know a lot of the things that go along with that. But if you tell me, hey, this is going to make it difficult for me as a diabetic, which I think you did with the insulin, which is why the insulin has been finally addressed over a couple of iterations. But your input, your advocacy does make a difference, and it is absolutely essential to the process.
Well, thank you so much for your time, and I'm gonna now turn it over to George, and he's going to tell you about the Army that we have that can help you.
Oh, great.
And Senator Bro, thank you so much for joining us. I want to echo Ed's comments, and thank you for your time and being here, and your team was, and thank you for running over to and leaving a committee hearing, because I know how that works, because these health committees.
Actually, I thank you.
Okay, well, that's funny too, because these committee hearings go for hours and hours and hours, and the topics are long. And the state legislature, Indiana's a part-time legislature, and everybody else, you're as much a volunteer as you are anything. I mean, we all deal in the advocacy world about volunteers. So I thank you for what you do, and the issues you deal with and the support that you provide people with diabetes. It's been a pleasure presenting and testifying to the committees and to work with you on this. And I really do appreciate that.
Well, thank you, George. I appreciate you and the work that you do as well. So thank you.
Super, super. Well, Ed, thank you for chairing this and moderating this panel and being the chief inquisitor, because he is that. That was really
George, may I just say, I'm seeing some questions that are coming through there that look like they're requiring some follow-up.
And we've got a team, Senator, working on answering some of those questions. And we've got another 30 minutes of dialogue on the specific issues. So I'm going to move the agenda on so that we can cover how we're going to address the how sausage is made and things like that. So I thank you so much for your time.
Now, do you want me to leave now, or do you want me to?
Well, you are welcome to stay, but I don't expect you to, because I know how busy you are.
No, I do have caucus now, so I do probably need to leave.
Thank you so very much.
Well, thank you, and have a wonderful session. What you do is important, and educating folks on diabetes. We've got to do it. Thank you.
Yeah, it is really important. So thank you both. And Jacob, could I ask you to put the presentation deck back on, and we can get back into the Indiana. So let's just talk. I think everybody knows we have two senators and who they are. Let's go to the next slide and talk a little bit about the Indiana. Okay, this is actually the National Caucus for Congress. There is a diabetes caucus at the federal Congress, 306 members. It's the largest caucus that exists disease state-wise. And the next slide will talk to us about Representatives Sparts and Mervin are the newest members of Congress from Indiana. And if you haven't already done so, we would urge you to ask them to join the Diabetes Caucus. You can do that from the DPAC website. So diabetespac.org is the place to go to send a quick note to Representative Sparts or Representative Mervin to ask them to join that diabetes caucus on a federal level. These caucuses make a difference. Indiana does not have one at the state level, and that is another thing that we encourage, because when these caucuses have the legislators talk about the issues with regard to diabetes, and they're always bipartisan, because diabetes is bipartisan. Sometimes the solutions aren't, but if we can get them talking around the issue, that's really what's important. Go ahead, Jacob. So Indiana is one of 22 supermajority states, supermajority legislators, where the Republicans, one party, in this case it's Republicans, have control of the Senate, the House of Representatives, as well as the governor's house. And it is a part-time legislature, as I mentioned. So this session is going to end by March 15th by statute. It must be adjourned by March 15th unless the governor has it go longer. It is really hard to get a bill going. Let's go to the next slide, where we'll talk about how a bill becomes law. This is how sausage gets made. There were over 1,000 bills proposed or introduced in Indiana last year. This is the state of Indiana last year, over 1,000 bills. Only 230 got passed. So it's an uphill slog. It starts with a bill sponsor filing a bill. Senator Bro sponsors lots of bills. So first, to get something done, you have to have a sponsor in the legislature. So you get that sponsor, you work with them, you get a bill positioned, and then they drop the bill, and it's called dropping a bill. And the bill then gets assigned to a committee, and that the chamber is either the House or the Senate, depending upon who the sponsor is. If it's a senator, it's going to go to a Senate committee. If it's a representative, it's going to go to a House committee. And so then you have to actually get a committee hearing on it. So you have to work with the chair of the committee to make sure that he or she will put it on the agenda so it even has a vote. Otherwise, it dies in the committee, which is very often how things happen. If you're fortunate enough to get out of committee, then it goes to the chamber floor, where again, you've got to work with the leader of that particular chamber to make sure it gets a floor hearing, because it can die there as well. And it can certainly get a no vote and die. And if it gets past that first chamber, it then goes to the second chamber. We start the whole process again. We've got to get a committee vote. So Senate Bill 88, which is the rebate pass-through bill, that Senator Bro was part of, she sponsored that and voted for it in committee. We got through the Senate for it so we got out of the Senate Health and Provider Services Committee, got through the Senate floor. It is now stuck in the Insurance Committee on the House side. We'll talk about opportunities through the DPAC website to send the chair of that Insurance Committee a message to say, we want you to give this bill a hearing at the Insurance Committee meeting. But our time is short. Again, we only have till March 15th, and really the committee hearings got to be done next week. So this bill is in jeopardy. We've got as far, we've never gotten this far, but it's in jeopardy right now. Let's go ahead. So let's move on to Advocacy 101 and talk a little bit about what does it take to be an advocate? And the answer is it takes you. And so what's a DPAC champion? A champion is a trained advocate, and it's not magic. It's not a college degree. By the time we get through this hour, you'll be a trained advocate, and you just need to have passion, and we'll talk about that. A community of advocates is really what is needed, and it's the champion to take all of our voices together and amplify those voices. So when we go to a hearing, it's on behalf of many, and the voices of many are heard louder and more clearly than the voice of one or two in the dark. So take action, invite 10 friends, follow us on social media, engage when we ask you to engage. We don't ask to engage too frequently, but when we do, we really need you.
It sounds to me like all the diabetes organizations ought to get together and put something out that we can all take and hand to our representatives that talks about what we need for health insurance if we have diabetes.
And that is a very good idea. And the good news is we did it. So and we did it right before the federal election, the presidential election. We worked Diabetes Leadership Council and Diabetes Patient Advocacy Coalition worked with 12 national diabetes organizations to come up with a consensus statement on healthcare reform, specifically through the lens of people with diabetes. I urge you, anybody on this call, to go hit the diabetesleadership.org website and download this piece, this consensus statement. There's a lot of areas, tangible ideas that the federal government should be doing, and many of which can be done at the state level as well. So I encourage, this is good nighttime reading. And the good news about reading something like this, and hopefully about going something is we get ticked off, right? And you say, why am I happy that I'm getting ticked off? Because people who are ticked off actually take action. And we should be a little ticked off here because we've got to start advocating. And how do you start advocating? Well, step one is become a DPAC champion. So please go to the DPAC website, diabetespac.org, and sign up. It's very easy. Just give us your name, your email address. We don't sell it. You're not going to get spammed. You're only going to get an action alert on a federal or a state level when something that impacts you is going to be, that needs your attention. You're not spammed. And unfortunately, it doesn't happen frequently enough, but when it does happen, we definitely need your help. Also, please join us on other events. We hold these in-person, we do virtual and in-person Hill Days. We do brown bags. These are lunch and learns that'll go deeper on some of the topics that we just barely, touched on in the last 15 minutes because we had, a limited time frame here. We'll go deeper during a brown bag session. And if there are other brown bag sessions that are on the DPAC site that we've done one on rebate reform that you can go through and you can watch the whole thing. Policy briefings, we're on social media. Please join us, please follow us. We can't do it without you. And tell your story. Each of us have a why on We Advocate. If you go to the DPAC site right now, support Senate Bill 88, it talks about that, but see that little box that says show more and tell your story. Please tell the representative why you care, why this is important to you. Keep it doing, lather, rinse, repeat, just like shampoo. Do this as often as you possibly can and share it with others. Share it with your family members, your friends, etc. That's really what it's all about. And thank you so much for being here today, guys. I know we ran 5 minutes long, but I appreciate you staying with us. Again, social media, follow us, sign up to be an advocate. please, please, please go hit it for Senate Bill 88 right now. And we're working on ways that we can. I know one of the questions was, is this bill dead? It's on life support if we can't get a hearing at the insurance committee level. And we'll see if there's anything else we can do to move it forward. And if it doesn't go forward, we will absolutely start this again next year. Advocacy is a long game. It takes, I started this when I was a baby. I'm now gray. But this is a long, long game to play. And so you got to have stick-withedness and perseverance. And that's really what we're here for. So thank you for your time today. Thank you for your attention. Stuart, thanks for being here and helping us walk through the topics of the day. I wish we had more time, but much appreciated. And we will aspire to be as well as Kentucky is with regard to the legislation that gets passed. Kentucky has done a great job there. Guys, have a great day. Thank you again. And let's go forth and make some noise.